Good afternoon, everybody. My name is Tim St Pierre. I am the Chief Research Scientist at Resonance Health Limited. And today I want to talk about the validation and comparison of the diagnostic performance of HepaFat-Scan for assessment of liver steatosis by MRI. Many peer-reviewed publications have reported relationships between MRI continuous measures and liver steatosis grade assessed from biopsy. MRI techniques typically measure a quantity called the proton density fat fraction, or PDFF. There are several different methods for measuring PDFF, and studies usually report cut points or thresholds of PDFF for predicting steatosis grades. However, the reported cut points in these studies vary significantly. For example, here are 8 studies that have reported exploratory PDFF cut points for predicting liver steatosis. In other words, steatosis grades 1 or above. The left-hand column of the table shows the first author of the study and the year it was published. We then have the number of patients in the study, and on the right-hand side we have the PDFF cut points that were determined from the data as the best cut points for distinguishing between grade 0 and grade 1 and above steatosis. And what you will notice is that these cut points range from as low as 2.5% up to 6.4%. And that range will have critical effects on sensitivity and specificity for measuring steatosis. The 2015 Standards for Reporting of Diagnostic Studies, or STARD statement, distinguishes between methods with exploratory cut points, such as the ones I showed you on the previous slide, and methods with pre-specified cut points. The reason for this is that there is an increased risk of overly optimistic estimates of diagnostic accuracy when estimates are made from cut points selected after the study data acquisition. In order to validate a diagnostic method for use in a given population of patients, prospective studies are required with the predetermined cut points that are intended to be used in clinical practice. To date, very few studies of MRI methods for measurement of steatosis have been carried out at this level of validation using predefined cut points. Most reported studies describe the retrospective determination of the cut points from the study data. In 2015, Schwimmer and colleagues compared PDFF measurements with biopsy-graded steatosis in 174 children. They tested 4 predefined, commonly used PDFF thresholds for diagnostic accuracy in determining steatosis grade 1 or above. The diagnostic accuracy that they found ranged from 69% to 82%. They concluded that no single threshold had sufficient sensitivity and specificity to be considered diagnostic for an individual child. In 2015, Tang and colleagues measured PDFF in 89 adults with suspected NAFLD and compared the results with biopsy-determined steatosis grade. They used a predetermined PDFF cut point of 6.4% for diagnosis of steatosis. And this cut point was determined from a previous study by Tang and colleagues in 2013. They obtained in this validation study a sensitivity of 86% and a specificity of 83% for diagnosing steatosis. This can be considered to be the first successful validation study of an MRI method with predefined cut points. HepaFat-Scan is a second method that has been validated against biopsy with predefined cut points. It is an FDA-approved medical device for measuring the volumetric liver fat fraction, or VLFF. It is provided as a core lab service, and the MRI data acquisition takes approximately 1 minute. It is calibrated against VLFF measured stereologically from liver biopsy sections. VLFF cut points for diagnosing steatosis grades using HepaFat-Scan have been determined in a study of 59 adults. The diagnostic accuracy using these predefined cut points has been subsequently validated in a cohort of 50 children. The HepaFat-Scan VLFF cut points were established from the study of 59 adults with liver disease by comparing the VLFF measurements by HepaFat-Scan with steatosis grading from biopsy by 3 independent histopathologists. The VLFF cut points were taken to be the average from the 3 histopathologists. And in the table, you can see that the cut points were 4.1, 12.0, and 16.2% VLFF for diagnosing steatosis grade greater than or equal to 1, greater than or equal to 2, or equal to 3. The diagnostic accuracy of these predetermined HepaFat-Scan VLFF cut points were validated in a prospective cross-sectional study of 50 children with liver disease and clinically indicated biopsy. VLFF measurements by HepaFat-Scan were compared with steatosis grading from biopsy by a single histopathologist. HepaFat-Scan analysts and the histopathologist were blinded to their respective results. The results of the validation study of HepaFat-Scan in children are shown in this table. As you can see, the sensitivities and specificities for diagnosing the respective grades of steatosis from biopsy were all above 85%. This, therefore, can be considered the second successful validation study of an MRI method with predefined cut points. To date, there have been only 2 MRI techniques validated with predefined cut points. One of them is HepaFat-Scan, shown in the yellow data points on this slide, and the other is the method of Tang and colleagues from 2015, which are the white data points on this slide. As you can see, for diagnosing steatosis, in other words, a steatosis grade greater than 0, HepaFat-Scan comes out with marginally better sensitivity and specificity. For the higher grades of steatosis, HepaFat-Scan has superior sensitivity, while the specificity is marginally less, but comparable to the study from Tang and colleagues. So, in conclusion, HepaFat-Scan is an FDA-approved MRI method for measuring liver fat. It is one of only 2 methods that have had their diagnostic performance successfully tested against biopsy with predefined cut points. It is the only MRI method to have been validated against biopsy in children using predefined cut points, and has a high sensitivity and specificity for diagnosis of liver steatosis. The core lab service model of HepaFat-Scan makes it ideally suited to multi-center clinical trial work. Thank you for your attention this afternoon.